Today we have a case review. This lovely patient came in mostly concerned about her nose, but noticed that she felt like her face was a little out of balance. She desired improvement of the nose. She notes that it droops when she smiles. She also felt like her cheeks or maybe her chin, just something was not quite harmonious with her face. And so my first approach is always to analyze the face and look at the different proportions and see where there may be deficiencies or excess and try to bring things into better balance so that it enhances their overall look. As you can see, she's a very pretty woman. She's got fairly good proportions. I would say her lower third of her face, from just under her nose to her chin, is a little bit lacking, needs a little bit increased volume. The other thing that we notice is that on her profile view or three-quarter view, there is a loss of some of the volume in this upper cheek area, and then the chin is slightly weak, as you can see in those views as well. Overall, her jawline looks good, and again, the nose has a slight hump and droopiness of the tip. And on examination, when you press the tip, it has a lot of give and no support in the tip. And so we discussed, the options of kind of doing the minimal amount to get a nice result, and we came up with doing the rhinoplasty, narrowing the nostrils a little bit with the rhinoplasty and lifting the tip and supporting the tip so that it doesn't droop when she smiles and kind of gets rid of that witchy type of look. The other thing that we decided upon was doing a little bit of fat grafting, and so that was done in the area of the upper cheek, around the mouth area and chin, and as well a small chin implant was placed. The rhinoplasty was done through an open approach, making it a little incision here underneath the nose and at the base of the nostrils. Likewise, an incision was made underneath the chin right in this location, and that does allow me to gain access for everything. We did harvest fat from her inner thigh in order to do the fat transfer, and that was done through little tiny poke holes in the skin in the area of the cheek and around the mouth. And so the result is just very nice enhancement of the upper cheek, the chin, and the upper lip area. Just overall nicely balanced. I would say that her nose is improved as well. She has a lot better proportions. The nose is not taking up as much of her face, and it also is not as projected as it was preoperatively. Her jawline looks even better because it's slightly elongated, and now the chin is not as recessed. It's more in alignment with her lower lip. The biggest thing to me is when she smiles and the tip doesn't go down. Her smile is more, it looks more joyful to me than it did preoperatively. And so this, I love seeing, the happiness in the eyes and the overall niceties of her face that are just enhanced with the surgery.